So I'll be looking or talking about two different themes today. The first one is an increasing overlap, or I claim that there is an increasing overlap between healthcare and fitness. And one of the consequences of this is that designer and the design profession could be considered a healthcare profession in not too distant future. We'll see if you agree with me here after the presentation. So, oh, that was really dark. Well, I'll base this on two projects that we've been working on over the last year. The first one is Joint Academy. I don't know, is there anyone from Joint Academy here? Let's probably make this easier so I will not present them. They're situated in Mink. It's a company that works with the online platform for exercises for people with osteoarthritis, a rheumatic condition. So it's a pretty straightforward platform, but I think it's a good, it's a really easy tool and a good example of this blend between healthcare and modern platforms. And what you hardly can see here to the right is a project we worked with for obstacle course racing, a bracelet or some kind of pod that you wear when you do obstacle course racing. So there are two people here crawling in the mud is what's supposed to be shown on the picture. And what I think with both of these is that they're kind of in that blend. Obviously, the one to the right are far more of a leisure activity, but it's still really vital that what you get out of this pod is accurate and accurate to the level of healthcare accuracy. Because these people, they're out running and they're out running for 24 or even 48 hours. Each lap, they need to come in and be checked by medics so they're allowed to continue. And some of these signs they check for are heart rate and like hypothermia and things like that. And they will, these pods they will carry would also hopefully give that information continuously through the tracks. And that would be an important additional security feature for these people when they're out running. So when this work and when we have this bracelet out, they will be able to get support if they get hypothermia out on the race or if they have heart conditions or heart problems out there. But then it's not really an option for this to fail or to have some glitch or to have bugs or to have. It needs to work. It needs to work 100% of the time, not as with the runner's watch. That is maybe okay if it crashes, if the only thing you get out of it is time. And I think that also this Joint's platform is just in there between. It's a platform. It's not something currently that's run by the government. It's a private platform that you just sign up as you sign up to any platforms. But it is definitely healthcare and needs to be healthcare grade. So I'll talk about the two different angles that I see here. And the first one I call fitness, and this is maybe not the best term, and feel free to suggest if you have a better word for this. But this is everything that relates to our health that's not healthcare put into this. So it's the continuous things that we do every day that affect our health in a good or bad way. It's what we eat, what we drink, maybe what we smoke as well. Like it's very affected by trends and fashions. It's in the commercial space and there's tons of choices. And to a large extent, it's focused on form or design or flavor or the maybe superficial, but also, of course, usability and all parts of what design is. And the consumer is the responsible person here. Like we're responsible to a large extent ourselves, of course, what we eat and how much we exercise and so on. And I want to just contrast that with the healthcare and this maybe a more traditional healthcare that is reactive, is something we attend to and use when we already are ill. It's far more based on drugs and maybe other heavy, hardcore interventions. It is pretty conservative by nature. I don't mean to say that this is all bad. The conservatism here is probably a very good thing, but it is a contrast to the what I call the fitness approach. It works in just a semi-commercial way where we as patients don't really pay the full price, and which obviously has some consequences in consumer patterns. The choices are limited, even if we have some private healthcare. Like a clinic is still a clinic. We can't really exchange the clinic for something completely different, or at least not if we should get the governmental subsidies. To a large extent, function is prioritized here. Anyone who's been in the old school hospital, I think, would agree that this is not architecture and design made to look pretty. It's definitely has a functional approach as the primary approach. And to a large extent, the medical staff is seen as responsible. Even when we come in as a patient, it's the responsibility of the healthcare staff many times to do the treatment to us more than ourselves. And of course, these are a bit, I've tried to make them a bit extreme, and this blend is already started to happen. And this is kind of the pinpoint of this overlap that I want to argue is already happening and will be happening even more, and should be happening probably. It's something that happens continuous. It's part of our more regular life. It's the combination where we use the drugs, but also focus on diets and other things like that to supplement that. Where we have the function, and function here maybe being that medical grade, a clinical grade, but also we need form and we need design, and we need to both make it useful and also, of course, be pleasurable in different ways. And we will have that responsibility from the healthcare sector, but also from us and from the everyday commercial part of life. Some trends that I think affect this area: globalization, maybe don't need any more explanation, data power, also artificial intelligence and big data. Miniaturization, we're making not just smartwatches and mobile, but also a lot of other measurements like blood and urine and things like that. We make those machines smaller and smaller, and we'll probably be able to have them as personal gadgets in not too long. And then the demographic shift is also affecting this. Of course, we're having a aging population, and with this we'll have an aging population that will need to be able to use gadgets. And I will come to that in the effect of that right now. So this is, again, could have made this a bit brighter, but the person here in the middle is my grandfather. His name is Bertil. He has been working as a farmer, but also working with making plastic signs. And the safety not being the greatest, his breathing and his lungs are not the greatest. So he has breathing issues. He would need something that would track and would help him keeping track of his breathing and respiratory systems. But he's not computer savvy. He's not someone who would give a smartwatch or something that would be too complicated. But he's also stubborn, and he do not want to be surveilled. So he doesn't want something where someone else would just check up on him. He would want to be in control of this. And this is, of course, part of that demographic shift. And so here I come to the first argument of, or the first part of where I think that the designers will have an increasing role in healthcare. So for Bertil, what he would need would be something that would be designed with that kind of demographic in mind, with someone who doesn't, his English is a bit limited, of course, and there's a lot of factors that we would not necessarily have to take into account designing for ourselves or for a younger demographic. So this is a heart rate monitor strap. And I just as a point, I wanted to prove the point of the being surveilled. Now I have this on myself, so I just wanted to make a point of how it is a bit intimidating having this heart rate being transmitted all the time. Like that surveillance is, now of course I did this voluntarily, but it is a point that it's pretty hardcore intimidation, and you give up a lot of privacy when you have this kind of surveillance. My point here is that design and the designers will be important to give healthcare to everyone. So the inclusion of Bertil and that older demographic and give them access to a fair healthcare, that will not just be responsibility for politicians or for healthcare professionals. That's a responsibility for designers as well. And this is a different approach, but a different argument of why design and designers will be important in healthcare. I have a friend who went down to Greece not too long ago. They had a bit of issues, some fairly minor things. They didn't need to go to emergency, but they wanted to talk to a doctor. They didn't really want to go down to the clinic there. They didn't know the English level. They didn't know exactly how it would work with cost and insurance and things like that. So they used their doctor that they've already signed up for at one of these platforms. And so they called home and they talked to a doctor that had some relation to their family and to their history, their health history. And they were not able to get the prescription, although I don't know if any of you listened to Anna previously. She actually claimed that should be possible in Greece to be able to get the e-prescription. Anyway, it didn't work in Greece this summer, but hopefully not too long. That should work within EU at least. And I want to also tie back to Joint Academy here, because I think that they fall into that category as well, where proper healthcare is accessed through a designed medium. You have people on the other side. In the case of Joint Academy, we have physiotherapists. In this case, there are doctors on the other side. But we access the actual healthcare through a medium that we as designers have designed. So the designer will be important in this access of healthcare. And beside that change and that increased importance for designers, of course, this is borderless, and it will have implications in both how we can access healthcare and when we're abroad, but also people moving here. Like what kind of healthcare would they want? Would they actually want the Swedish healthcare, or would they want to bring with them a healthcare from afar? And will we be able to use healthcare from a place where even doctors have a less salary and are less costly? So my third argument why designers will be, so to speak, a healthcare profession is the computer-aided diagnosis. So what I'm including here is artificial intelligence and big data and number crunching, and also image analysis. You know, if you heard about this, the Japanese case was reported just last week about a woman with a rare form of cancer, that they sent in all these markers into Watson, and with that number crunching, they managed to find out what kind of cancer it was in a matter of minutes, something that it was claimed would be weeks or months for humans to analyze, because you will need to cross-reference all these markers to a huge set of data. And of course, there's some mathematicians and statisticians and doctors involved in this. And they're, of course, they can't be replaced. But to access this, even for a specialist, for a special doctor, they would need to use some kind of UI towards Watson, and they would need to interpret the result. Again, this UI would need to be designed. So the designers, the design profession, will actually be core in doing this, like in making this diagnostic tool. And without that explanation through that interface of this really complex problem, the diagnose and the treatment will not be as efficient, or maybe even misunderstood and dangerous. So that was my arguments. I want to bring up some ethical concerns when we talk about all these, just because I think it's a bit irresponsible to not mention them. I don't have the solution to these, unfortunately, but obviously we have some privacy concerns when we bring in these digital services and when we talk about internationalization and globalization of our data, and like where do we draw the line between what data we share with our public and other kind of services. And disparity of access, what I mean here is for Bertil and maybe for other people that's less computer savvy or doesn't have the financial access to computers, how do we make sure that this is not just a way of increasing that gaps between the haves and the have-nots? Like, how do we make sure that we don't make the difference between the health in the more affluent part even of our own society, but instead could be cheapened, could be lessen the cost of healthcare, so we could give it to more people and give better care to more people. And lastly, I think that it's important also to think about the psychosocial aspect. So when you get a diagnosis, or you get something from your doctor or even from a nurse that you have some kind of condition, they're also trained in being empathic and helping you getting through that. If you get that information through when you're sitting at home, when you get a lab back from the computer, or lab results back from the computer, who's there to support you? And can we do that through design? Or like we have a responsibility of not just providing that result too bluntly. So these are just wrap up and come back to these are those three main points. That I think that the design will be the king, or maybe possibly the kingmaker of what services that will win in this. The design will be important for participation, making sure that everyone could be part of this. There will be design or designers, and the design community will be important for having access to all these services and making that access useful for us as consumers or as patients. It will also be important to actually create that diagnosis and that treatment.